Okay, happy Friday. Hey Seattle, how about that sun outside, huh? Enjoy it while we can. Anyway, Brooke again, here for another installment. Oh, my head's getting cut off by the camera. Another installment of rehabilitative exercise. This time, this one can help us with pain that we get from knee injuries. And me, as someone who has some left leg weakness that is still persisting from my MS flare up, this is an exercise that I have been doing sets of several times a day. But if you're someone who has knee pain or knee pain resulting from leg weakness, particularly quad weakness, this is an exercise that I don't remember where I learned it, but I've used it with clients that I've worked with in the past, and I use it with myself regularly because prior to this flare-up, I have quite the past. I've had 2 surgeries on my left knee, 2 surgeries on my left hip, and also 1 surgery on my foot, on my left foot. So I have quite the orthopedic past, as well as this. All of my MS flare-ups have affected my left side. So it's important to keep my left side strong. Now, maybe you have noticed this, but women are often more prone to knee pain than are men. And maybe you've noticed this as well. Or maybe it's just those of us who study anatomy, physiology, kinesiology, blah, blah, blah. But women have wider hips in general than men do. And the angle... the angle puts quite a strain on knees, and that's because women's hips are designed. I hate to use that word, but it's probably the most convenient word for childbirth. And that's why women's hips tend to be wider. It's not from all the dessert we eat, right? No, it's just but the pelvis is wider to allow for the birth canal, and because the hips are wider than the knees, that puts strain on the knees, especially as we get older over time. So, that said, this exercise employs a foam roller. Also, if you don't, I just think this is such a handy tool. So, get one. If you don't have one, you can also do this with a stack of sturdy pillows under your knees. But this, being sturdy and not very squishable, is useful for this exercise and so many others. So you're going to put it perpendicularly under your knees. And the first thing you might notice, other than, wow, I have this thing under my knees that puts them in a bent position, which is where you want to start, is that when you put it under your knees, depending on your strength in your deep abdominal muscles, it might automatically start rolling you back behind your tailbone. Of course, that's not optimal posture to have us slump down and rounded forward. So while we do this, we're going to try to sit upright. And even that alone is a good exercise for our core muscles, and you might want to have your hands at the side to give you a little bit of traction to take you upright, so the crown of your head toward the ceiling. I have been doing this enough, and that I hope that I am upright, because I'm going to use my hands to illustrate a few things. So for this exercise, you're going to try to keep everything still, including your torso. The only thing that's going to move is your lower leg. And getting a good camera angle for this, I will admit, is really tough. So at some point I'm going to pick up my phone and show you a couple other things from different angles. You won't be able to see me, but you'll be able to hear me, and that's the important thing, right? So what you're going to do, you're going to keep your knees pointing toward the ceiling, so no roll out, no roll in, pointing toward the ceiling, and you're going to take and extend your leg at the knee until it's straight, not locked out, but just take until it's straight and lower it down. The thing here is you're getting the last part of the extension, not the full extension, and that employs the little muscle on the inside, the vastus medialis. And that, in us women, is what usually is the weaker of the quadricep muscles. How many muscles are in the quadriceps group, do you think? What does quad mean? 4. You got it. So with the vastus medialis being weak, if you have a weak vastus medialis, that pulls your kneecap off track, and that's what causes a lot of the pain. So this is my weaker side. I don't know if you can see this because my foot is like way off camera, but I'm going slowly. Ooh, now my foot looks huge. And I'm holding at the top for a little bit, and you can see that there's a little bit of a bounce. That's what happens on my weaker side right now. What I have been doing is sets of 8. That was 7, I believe, and that's 8. And then I go to my better side. And just to make things evened out, I do a set of 8 there. You can see, I don't know if you can see this, there is no bounce on that side at all. So yes, I extend up slowly and hold for just a few seconds and release slowly, no thudding back down. We want to make the muscles work. And I'm still sitting upright as much as I can. It is late in the day on Friday, so all bets are off. So this is my good side, but I try not to neglect my good side when I'm doing therapy, because sometimes I've only worked on my bad side and I overcompensate and my bad side becomes stronger than what was once my good side. And that's no good. So I'll do 2 more here and then I'll go back to my affected side. I want to point out one more thing. So usually I've been doing 3 sets on my affected side and 1 set on my non-affected side. And just over time, I'm going to see how things are balanced out. Okay, so there we go. Back to my affected side. And I want to show you one thing. So how do I know that the muscle is working that I want to have work? One trick that I've learned through my training and working with clients and patients is put my hand on the muscle or put some fingers on the muscle that I want to have work. And that's actually a trick to get the muscle to work more. It's like a tactile stimulation. So I'm putting my fingers on the muscle fibers, and you can't see from this angle, but I'm going to try not to make you too dizzy. I'm going to come over here and grab this. Close your eyes if you need to. And from this angle, you see from this angle down here, you see the inside of my leg. My fingers are around where the vastus medialis is, and my hands are not on the foam roller anymore, but I'm still trying to sit up tall. Oh, there we are. Hello, leg. And underneath my fingers, I can feel some muscular contraction as I extend, hold, and release. My leg is getting a little bit shakier since this is now my 2nd set of 3. I'm going to do 2 more. And 1 more there. And then I'm going to release and take a couple seconds break, and I'm going to wrap up this video here and then do my 3rd set after I've signed off. So, again, that's just something for strengthening the muscles to support the knee, and that can help alleviate knee pain over time. And one of the things that I'll tell you is if you don't feel that vastus medialis the first time you do this exercise, be patient. Patience means everything. So I've been doing this every day for a little over a week as part of my therapy. And the first time that I did it after this MS flare-up, I was putting my hand on my vastus medialis. I didn't feel anything, and it was so discouraging. I didn't feel the muscle contract at all, and I was thinking, am I going to get this muscle to come back at all? So I did it for 2 or 3 days, and then I was starting to feel something. So patience pays off. Keep on going, keep at it, keep on doing it, and it's just going to happen. And that's how I'm living my life right now. So happy Friday, happy weekend, and I'll see you again in a few days. Thanks.